Hello, all my friends in TV land. This is Senior Issues, etc. I'm your host, Vita Verdon. Hurry up, get your coffee, quickly, come and sit down. I've got an interesting show for you. I want to wish all of you in TV land, all my friends out there, you know, this is Mark's, we've been doing this now for 15 years, a very happy new year. And this year, the best is yet to come. Now, the show I have for you today is very interesting. It's very interesting to me because it happened to me. A few months back, I felt a little lump on my left eye, on my left eyelid. And I thought maybe it was a cyst. Now, I go for annual visits with my ophthalmologist. And so I had an annual visit coming up. So in my annual visit, when my ophthalmologist looked at it, he said he didn't like the way it looked. And he introduced me to the guests that we have here today. The guest I have here today is Dr. Milap Mehta, and he is a plastic surgeon and an eye surgeon with the North Shore system. And so what they recommended, what Dr. Mehta recommended was a biopsy. So I went through the biopsy, and I was shocked when Dr. Mehta called me and said that it was cancerous and it did require a form of surgery. And that's what we're going to go into today, is the whole procedure. But I know how you are out there. I know what you like. First of all, what you like to find out is you like to find out the personal things about the doctor. So I want you to sit back and relax and give a warm welcome to Dr. Milap Mehta. Nice to have you here today, Doctor.
Thank you so much for having me.
And so we were talking before the show, and I found some things so interesting. I think that our audience out there would like to hear about it. I know that you were the last of your family to be born outside the country, right?
That is correct. So all of my younger family, cousins, brother, were all born here, and we all live in the Chicago area. So it's kind of a wonderful thing to have the family together.
And then also everybody in your family is a doctor. That's so interesting.
Yeah, there's a lot of cousins, a lot of members of the family in a row who are all physicians. So it's nice at family gatherings, if somebody gets injured, you always have a person who can help you.
Now, where did you go to school?
So I grew up here in the Chicago area, went to high school in Skokie, and then I moved to Philadelphia. I went to Thomas Jefferson for medical school. Then my wife and I went to Washington, D.C. I was at Georgetown for my ophthalmology training, so I did my eye surgery training there. And then we finished up at the Cleveland Clinic for facial plastic surgery.
Well, you whizzed right through that. Your wife, we didn't get you through school, and you're already, now what point did you meet your wife?
So we met in between medical school and finishing and starting my surgery training. So it's been a long time we've been together.
Well, we want to go through a few things, and that's the love of your lives. And I know a big part of the love of your lives is you have a set of twin girls, which will be 2 on this coming Sunday.
That is
correct.
That correct? So happy early birthday to my daughters. They couldn't be here today because it's cold and I don't want them to get ill before their big party. But those are my 2 kids there. The lovely one in the purple is Riddhi, and the other young lady right next to her sister is Richa, and this is Christmas morning. Richa's coming down the stairs here, and her sister already beat her down the stairs and is working on the opening presents.
Well, you send 2 kisses out to them, right into that camera.
To my kids there. Yeah.
Okay, 2.
Oh, 2. Okay.
All right, now your wife.
And then to my wonderful wife, Anjali, who's had to go through all the training and schooling and all the traveling.
This is a big
Oh,
smacker.
you get a double.
Yeah.
Yeah.
And then, how about your mother and father?
So I've got mom-in-law, dad, and grandmother at home. So I want to give a wonderful love to everyone there as well.
Well, you have to blow a kiss.
To everybody as well in the family.
How about your grandmother?
And grandma as well. So she should get 2 because she has to put up with us every day, and my kids.
One last one, a bonus for all the doctors in the family.
And to all the family members, all the other doctors, my siblings, to all of you as well.
And so, okay, now we have you. You came. You went through schooling. Then you had the twins. It'll be 2 years ago on Sunday.
Yeah.
And so you decided on plastic surgery.
So during medical school, I was deciding between one of the surgery subspecialties. So my big choices were plastic surgery, eye surgery, and ear, nose, and throat. And so I was going through the different rotations and trying to figure out what I would enjoy, what I think I would be good at. And I really enjoyed eye surgery. It was a lot of fun. You get to make patients happy right away. And during the first year of my eye surgery training, one of my mentors in Washington, D.C. at Georgetown said, well, why don't you become double trained like I was and do both? And then you can kind of bridge and decide what you'd like to do, and you can kind of take the best aspects of both specialties.
Oh, you're talking about eye surgery and plastic surgery.
So I'm double trained, and when I started my initial the education there, I wanted to just be an eye surgeon. Right. I met a wonderful set of doctors in Georgetown who were like, why don't you do both? It'll just take you a couple extra years. I know my father wasn't happy that it'd be a few more years that he'd be helping pay all this off, but I think it was certainly worth it.
Now, are you artistic in any way? Because it seems to me it takes a certain artistry to decide on the procedures and how to actually do them, be hands-on.
So I don't paint, but I do play musical instruments, and I've been singing now for almost 25 years. I've actually cut 2 live albums.
So there is a creative surge within you.
I think so, yeah. Right now I mostly sing nursery rhymes, but I can still belt out a couple tunes if I have to.
So that's like within your genes.
I hope so, yeah.
Now, you're the only, out of all the doctors, you're the only one that's a plastic surgeon.
That is correct. I think we have a variety in the family, but I'm the one that was kind of drawn to this type of procedures. I love the ability to work on delicate structures and put people back together and still make them feel normal and feel good after I'm done.
Isn't that nerve-wracking to work on such delicate structures? How do you keep yourself calm enough?
At some point it becomes part of your everyday routine. I never like to use the word routine and surgery because then you're kind of diminishing what the person's going through, what the patient is going through, and what the rest of the staff is going through. I think the big thing is having respect for what you're going to be doing, having respect for the family and the patient especially, and having trust in your skills. If you've done things thousands and thousands of times, you start to develop that confidence within yourself.
Well, I know when you called after the biopsy, because it didn't even cross my mind that this could be cancerous. I never heard of it in the eye like that. And when you called, the first thing that happened to me is I went into this cancer freeze. Me? Cancer? No. It can't be. There must be a mistake. But it wasn't a mistake, and I'd like to talk about that a little bit because I know that just the word itself draws fear out of people.
Yeah, it's got such a negative connotation, especially when dealing with the face, the eye, the eyelid, the nose, the eyebrow. It's such a scary thing to hear. And so part of my job is not just fixing the problem, but it's educating patients and saying, look, first thing I always say when I give the results is take a deep breath, and then I give you the results. And I say, no matter what we deal with here, we're going to do it together, and we're going to make sure that you feel fine after I'm done, and we're going to take care of the problem by cutting it out.
Well, one of the things that I'm so grateful to you for is not only are you a fine surgeon, but in the process of explaining to me what I had, you're a very detailed communicator. And in the detailing of the communication, it took a lot of the stigma out of me of, how could this be? You know, what is that? Is it something unknown? Because you sounded very much like you knew what you were talking about. And that gave me not only a comfort, but a confidence that I could release myself into your hands, and it was going to turn out to be just fine. So I was really pleased about that. We're going to go into the details of the procedure, but first of all, what I'm going to do is what we call Vita's Pearls of Wisdom. Okay, winter is upon us. This happens to be such a cold day today that we're filming. It's -3 degrees and there's all kinds of snow. You know, years back I had broken my femur, so I have a plate in my leg. So when the weather gets bad, I do use a cane. Now, I know I've done this on several occasions, but I can't do this enough because I'm so pleased. This is just an ordinary cane that I got while I was in the hospital, and I got it through Medicare. But what I got at a medical supply house is, I don't know if the camera can pick this up, but it's a little apparatus that hooks onto the bottom of the cane. As I can flip it up, what it is, it has little prongs on it. And on days that it's icy and it snows, that you put it on the bottom. Now, if you can see those little prongs stick out, and that when you're going in ice and snow, it helps to grip it. And I have had this now for about 4 or 5 years, and I tell you, it's one of the best investments that I've ever made. And it's so easy. I keep it attached, and that when it isn't like that, I can just use the cane in that direction. That's one of my tips for you. Another one of the tips that I have is, if you have an idea for a show, or you're interested in coming to see how the show is filmed, or you're interested in learning how to be an intern, if you go to Senior Issues, etc., is etc.org, that is the website. On the website, on the home page, you're going to find out all the different places that the show is seen, and you're also going to find out that we have about 30 shows online. And if you just scroll down, there is a link, and press the link, and it will show you it's in order. The last show that was filmed will be the first show up, and you can view the shows. Now, if you want to contact me, my email is vitaverden@netzero.net, or you could telephone me and talk to me about your ideas or what you're interested in doing. It's area code 847-573-1233. You know, with winter being at hand, I want you really to be concerned on not only walking outside, but how the inside of your house is. And so many accidents happen at night if somebody gets up to go to the washroom. When you get up from your bed, remember, just sit on the side of your bed for a minute. Don't rush up, okay? Then when you have your footing, be sure that you have a night light or there's some kind of view. And one of the things I want you to do in your house or your apartment is, if you have any rugs that don't have something to keep them leveled down, pick them up, because so many accidents happen when people get their foot stuck in the rug. And you know what our goal is, to live forever, and we're stretching it as far as we can stretch it. You know that we're the first generation that has lived as long as we're living, and we have come, since this show started, from the minority into the main lead, with the baby boomers catching in. Now that I've given you all these tips, stay well, we're going to get back to this procedure. Okay, so now what we have is I have learned that I have cancer in my left eye. Now maybe we could start that you could explain how you explained it to me, what this cancer was, and the method and the name of the method of what the removal of this cancer, what the name is called.
Wonderful. That's a great place to start. So
Okay.
First thing we always start with, as you correctly described, is a biopsy. So if we could show the first slide here. And with the biopsy, you want to make sure that you're able to take the area or the bump or the lesion or the mass, whatever you'd like to call it, and you want to make sure you get a little area around it that has normal tissue for the pathologist to compare this. So that was the first aspect we did.
Okay.
We send the specimen to a pathologist, which is a medical doctor who specializes in dealing with microscopic analysis of different tissues. They're able to tell us, is this a basal cell, a squamous cell, melanoma, or one of the more common skin cancers. That's what we thought this was before I got started. After I get the results, I like to review the images or the slides with the pathologist to make sure that we're not missing something and we're on the same boat, because there's nothing worse than telling someone they have something they may not have.
Right.
So we always review it a second time. Then we call and we talk about it and you come back in to discuss it. Can we go to the next slide? That's perfect right here. This is called a Mohs procedure, M-O-H-S. And Mohs is a technique, I liken it to slicing bread. And what you do is you try to take a little area, front, back, left, right, top, and bottom, in a three-dimensional structure in order to clear a cancer. And then you ink the different edges so you know which side is which when you look at it under the microscope. And you may say, as example on this photo here, that the top and bottom look fine and left and right look okay, but you have to go a little bit deeper to get all of it, in which case you'll take another slice and add it to the original. So you keep expanding things in different directions depending on what it looks like.
But how it worked is I had the first procedure of the Mohs, and then I had to wait for the biopsy to come back, and then I was told I needed another procedure.
Correct.
Another slice.
So what we do, just like you correctly said, is we'll
Yes.
take the first slice,
Right.
and we have to make sure under a microscope that all of the edges are what we call clear. Clear meaning there's no cells growing into them. And often it takes 2 or 3 or 4 passes or 4 slices in order to get everything, because we start with what we can see. So that's where we start, is based on what I actually can physically see. And after I cut what we can see, we have to expand it microscopically. So you're correct, it can often take multiple slices to get everything. But after we're done, the goal is for you to be tumor-free, but you're often left with a very large hole in the face that we have to put you back together the next day.
So I had these 2 procedures done, and the 2 procedures done were done by dermatologist surgeons.
Correct. And so
Okay.
they are called Mohs surgeons or dermatology surgeons, and they're the ones who perform that and are able to look at the slides immediately and tell us everything looks clean.
And that's all these doctors do is surgery.
Correct.
You don't go for them for an exam visit. They just strictly do surgery.
Yeah.
So then I went home, and then the next day I came into the hospital, and then I was ready for you.
You are correct. And so after we take care of the cancer, the next step is to put you back together and make everything work the way it's supposed to work, look the way it's supposed to look, and feel the way it's supposed to feel. So we have a couple of techniques around the eyelids and face in order to help us put you back together, because you can't just take a piece of skin and sew it on there. A skin graft in different locations is often very valuable. But around the eyelids, you can't just put a patch on there and call it a day. You actually,
because it has to function.
It has to function and move appropriately. So we take grafts that usually rotate tissues from different locations. So if we can go to the next slide to show that. So this is a technique where we'll actually bring the edges of an eyelid together. You can see a pentagon in an upside down fashion there. That just shows a hole in the eyelid that goes through and through. You can actually see the person's eye when their eye is closed with that kind of hole. It shows us how we put things back together. Can we advance one more slide? This is a technique, and this is the one that we used for you, where I'll make a small incision and I'll advance tissue from the temple and from the cheek to fill in the eyelid. And that's the technique we used for you in order to fill in the big gap that was there.
That's done in this section.
You are
right
correct.
Here.
And about half of your eyelid to a little more than, about 60% of your upper eyelid was missing up to the brow. And so the most of the tissue on the outside corner is actually artificial tissue. It's a tissue that's from the temple that I advanced for. Exactly. And it's all done in what's called a pedicle, which sort of looks like a peninsula. It's attached at one point, and the other 3 points are advanced forward to bring the eyelid and the tissues back together.
Uh-huh.
Yeah. And if we could advance one more. And this is the actual technique we used for you.
So on the side, that's the section in which you drew that over.
Correct. And
now,
so
does that stretch?
It does stretch. You have to use a little bit of cutting underneath the surface just to loosen the attachments. But you'd be surprised how far things can move if you give it a little tug.
Now, the thing that surprised you, and it surprised me, is I had relatively no pain at all with this procedure.
That's wonderful.
But what I did was I followed to the T what everything that you had documented for me to do to take care of it.
So I have a lot of instructions after surgery to help you with wound care and help you with caring for all the feelings you're going to have. Usually that first 5 to 7 days after surgery, you feel kind of a scratchiness, some tenderness, some pain. As the superficial stitches, the ones that are on the surface, start to break down. Those usually take anywhere between 10 and about 14 days to break down. Then there's deep stitches underneath that are actually structural stitches. Those break down in about 2 to 3 months. And often you have some discomfort that first couple of days to the first week. But if you use lots of ice and lots of the medicated ointment, you're often feel a lot better quicker. So that's a great point there to make sure that you follow all the instructions that we give you.
And being a diabetic, I know that ordinarily I'm a slow healer, but on this, I healed, not only rapidly but pain-free, which you said seems to be unusual.
That's very rare. Most patients will have some pain the first week. I'm not going to take any credit for that. We'll give your body the credit for that one.
Now, what I wanted to point out is in this area, you're one of the few doctors that does this procedure.
You're correct. Even though this sounds like a very rare condition, on a given month, I see anywhere between 8 and about 10 or 12 patients who have a form of skin cancer in and around the face and including the eyes. But in general, in the Chicagoland area, there's probably about 10 or 12 surgeons who do this. Nationwide, about 500 surgeons who do these types of surgeries. So,
but in comparison to the population, that's still a very small amount.
It is, and so I personally get a lot of patients with these conditions, but there aren't a lot of them in the general population, not as many as you think.
Oh, what I'd like to talk about a little bit, because I know this is considered to be the new procedure, but there was an old procedure, and I know the old procedure seems anarchic at this point, with the new procedure being so much more sophisticated. Maybe you can talk a little bit about what the old procedure was?
So one of the original techniques for fixing eyelids when there's most of the tissue is missing, or at least half the tissue is missing, it's where we'll actually stitch the two eyelids together. And for example, if it was your upper eyelid, which was the case for you, I'll take a graft of the lower lid and advance that forward. One of the downsides to this, I wouldn't call it an ancient technique, but one of the big downsides to this technique is your eyelids are stitched together for anywhere between 4 or 5 or 6 weeks while the two grafts are healing, which is often very difficult for patients to deal with. You have one eye that's closed, and then it requires a second procedure to divide the two eyelids to give them their shape again. And so I always think in my heart, if you have one bad eyelid, why would I give you two by weakening in another one? And why would I have you keep your eye closed? I still have to use that the older technique where I'll share them, but it's very rare now.
Oh, now, one of the things I'd like to ask you is, where does your passion lie? What kind of gratification do you get out of the type of work you're in?
It's a great question. So, this is one of those that you ask when you're starting medical school and you're deciding what type of physician you'd like to be. But for me, one of the greatest things I get to do is on a daily and weekly basis, I take care of very vulnerable and very scared patients, and I get to guide them along a path that's often rare and scary, and make sure that they're comfortable and safe, and I get to put people back together. So I get to use a lot of the skills that I have. I get to be artistic, I get to be comforting, I get to work with a lot of my buddies and learn a lot. So it's not just the comfort I give and the service that I give. I get to get a lot of gratitude back. I have some of the happiest patients in the world after I'm done.
Well, not only are you one of the skilled, outstanding doctors in this area, that you're so approachable. And I think that your approachability takes care of more than 50% of the healing factor, that a person could have confidence that it's your personal personality comes out. They call it the bedside manner. That comes out to give a person confidence. Now, what would you recommend to people, the 5 points?
So there's 5 things I tell everyone in terms of skin cancer, and these are just general principles. Number 1, wear a hat, wear long sleeve clothes. Do your best to avoid the sun unnecessarily. If you're going to be out in the sun, sunscreen, replace it every couple of hours, even if you think it's going to last. Put it on every 2 hours, even if it's waterproof, put it on after you get in and out of the pool. Number 3, see a dermatologist every year. It's just good behavior to see somebody every year to make sure things are looking the way they're supposed to look. Number 4, if you see something mischievous or unusual, have it biopsied. It doesn't take more than a couple minutes for us to really know what we're dealing with. And number 5, always work with a team. So not everybody's going to have every skill, but if you had a team in place, somebody's going to be able to give you some good input and work together to help you.
So if you are suspicious of anything on your body, don't wait until it grows out of proportion. Go and have it checked out now. And having it checked out now, it's better to be safe than to be sorry. And we're starting the new year with an up attitude. This is going to be one of the best years for us. And when you come to the end of the rope, you tie a knot and you hang on. And you know why you hang on? Because the best is yet to come. And what we want you all to do is to catch the spirit.